Hi.
Hi, it worked.
How you doing?
I'm good. I got a little bit of a cold, so if you hear me sniffling, coughing a little bit, it's because I'm getting over a cold.
Wow, it's good seeing you, Louise. That's how you pronounce
It's
it,
good to see
Louise?
you. Hmm.
Okay.
Yep.
And your daughter Isabella, right, is going to be joining us here and there as well, in and out maybe.
Yeah, she's gonna come in and out. She usually doesn't stay put with me very long.
Gotcha. Well, Nell wanted me to send her deepest apologies that she's not going to be able to be here, so she's still recovering from some dental stuff that
Mm.
she's had on top of everything else, and she wanted to be here. So I'm
Oh, it's
sorry.
okay. I understand. No, no, she doesn't need to apologize. I completely understand.
Well, we're excited to have you today. This is actually our first interview outside of North America. So we
Yeah.
we have we've interviewed someone in Canada, and we've got uh, one in Australia now, and Scotland and UK. But you're the first interview um, internationally, if you will. So this is exciting
Wow.
to have you, and you're
It
you're in
is.
Ireland,
Thank
right?
you. Yes, yes.
A little bit of a time difference, and this is absolutely going to be one where I think people will watch when it's on YouTube. Folks aren't used to
Yeah,
having us go live on Saturday, but to accommodate the time difference, it's 9 o'clock where you're at, and it's 2 o'clock where we're at.
yeah,
And so when that
yeah.
gets uploaded to YouTube, you can share that link however you'd like, whether that's on your link tree or anything. A lot of people, understandably aren't going to be able to join now, but we want to give that opportunity for you to share your story. It's really inspiring.
Oh, thank you.
Yeah,
Thank you. And I appreciate it. I mean, I
absolutely.
definitely, feel that rare diseases definitely need to be more spoken of,
Absolutely. And
especially now that I'm here in Ireland.
to give the viewers the kind of an overview of kind of what we're going to be going over, you guys, she's had um, brain surgery, uh,
Yeah.
Ehlers-Danlos syndrome, Larsen syndrome, POTS,
Hmm.
Chiari type 1 scoliosis, idiopathic intracranial hypertension, mast cell syndrome, and then your daughter has Chung Jansen syndrome, Ehlers-Danlos,
Yeah.
epilepsy, mast cell activation. Does that all sound right?
Yes.
Yeah, and
Yes.
I mean that's a lot to unpack, and we have about an hour, and so generally what we do is kind of just let you talk a little bit about what your experience has been in terms of maybe coming into the TikTok space, how you came in contact with us, what are some of the things that you enjoy following us and the people that we're interviewing you, and then as far as just going back and talking about kind of when some of the things started, to just go back as far as you want and just kind of take us for a ride, with what you've gone through. So with that, let me just turn it over to
Yeah,
you,
definitely.
Louise, and take it away.
Okay, so let's see. I mean, as a kid, I was sick all the time. Things that I thought, for me were normal. Doctors were always like, oh, it's nothing. Oh, you just, it would be breaking out in hives, for instance. Oh, you probably just ate something. Okay, no problem. Or my knees. My knees were the first thing that really stuck out. Because I didn't do sports, but for some reason I would have like random swelling in my knee. It hurt to walk sometimes. And they kept saying, it's growing pains, you'll be fine. So for years, I've lived just thinking it's normal. It happens to everybody. And not until Isabella was born and we were noticing stuff with her that weren't normal, not reaching her milestones and things like that. Um, that was her.
It's okay.
I started just digging for her health. Like, something's wrong. I know something's wrong. I do have two other children that are older than her. So I was like, something's really wrong. She doesn't cry. She's not a typical baby. She sleeps a lot. Like, something's wrong. She can't hold her head up. She can't do anything. They were just like, she's a floppy baby. It happens. To, I think the biggest one that really got me amped up to really search for answers was when she's around, I'd say 11 months old. And I took her to a neurologist, and he's like, oh, she's just retarded. His exact words to me.
She's what?
And I was like, he told me, he's like, she's just retarded. That's what we call it. And I was like, wait, what? And he goes, yeah, that's the medical term. And I was like,
Whoa.
no, I don't think so. Yeah, so it was it was abrasive, it was rude. And it was just from there, it just, I was kind of put off by it. I was used to be very timid.
Yeah, I
But
don't
then it
blame
went
you.
from him saying that to me really like, no, there's something wrong with my child. You're not going to sit there and say that word to me without further explanation, further testing. Something is wrong. So there it went from just seeing more and more doctors to finally meeting up with a rheumatologist by chance. I got in with this pediatric rheumatologist who looked at her, and he's like, there's something wrong. And I'm like, oh, okay. Well, they told me that she has mental retardation. That's what it was. And he's like, no, no. He's like, this is way more than that. He's like, the reason she can't hold her head up, the reason she can't walk properly, he goes, is because her joints are too lax. I was like, okay. I was like, well, what does that mean? He goes, have you ever heard of Ehlers-Danlos syndrome? And I was like, no, never heard of it. And he's like, well, let me look at you real quick. And that's when he started looking at me. He goes, you need to go get genetic testing done for both of you. He goes, I have a strong suspicion that you both have Ehlers-Danlos syndrome. He's like, you as an adult in your 30s should not be this flexible to where it doesn't cause pain. I'm like, oh, okay. So from there, we met with a neurodevelopmental pediatrician who, again, she's like, no, this is genetic. Something's going wrong. We need to figure it out. So she ran, I'd say, 3 different panels for specific diseases. One was Fragile X syndrome, Prader-Willi syndrome, and Angelman syndrome, which all came back negative. And all 3 of those diseases people hear about, but they don't really know about. So I was like, okay, well, where do we go from here? And she goes, I think we need to do whole exome sequencing on Isabella, but your insurance is no longer going to cover genetic testing because we've already run 3 different tests. So I was kind of stuck. And she goes, she needs to see another neurologist. We need to see, what's going on with her, to see if they could do some imaging of her brain. I'm like, okay, fair enough. Then it was the second rude doctor. So we go to one of the biggest children's hospitals in Arizona, because we lived in the States at the time. And that neurologist looked at me. She goes, there's nothing wrong with your daughter. She's fat. I'm like, did you read her chart? Did you see everything else that's going on? And I was like, I really just need a brain MRI because we need to see the growth of the brain and everything like that. That's what the neurodevelopmental pediatrician wants. And she's like, why? Because she's just fat. And then from that moment on, I was like, well, that's funny because she's had these issues since birth and she was failure to thrive, which means she's below the 5th percentile for weight. I was like, was she fat then too?
Yeah.
And she's like, well, I'll do the MRI to appease you. And I was like, no, thanks. I don't want it.
That's how he was treating
I don't want
you?
you as her doctor. Yeah. Yeah.
Oh.
So then I actually went onto Facebook because there was a group for special needs parents on Facebook for Arizona. And I was so upset. And one of the moms reached out to me and she's just like, I know you're going through a lot. I know this is really stressful, but I want you to call this place. She's like, it takes forever to get in, but I think it might be worth your time. And it was TGen, Center for Rare Childhood Diseases. So I remember calling them and I remember crying. I was just with everything just coming down and with me not having answers for her. And then my health started to go. I couldn't hold it in. I was just crying to the nurse. She goes, listen, you've already had genetic testing done. If the pediatrician, the developmental pediatrician all think that it's genetic, let me talk to the doctor. It'll take about 6 weeks for them to congregate. She goes, because there's about 6 of them and they all have to discuss and accept you on. So I was like, okay. So, ready to wait the 6 weeks. But the next day I got a call back and she's like, the doctors want you in tomorrow. Can you come get your blood drawn tomorrow? I was like, done. Totally there for it.
Mm-hmm.
And then it ended up being a neurologist who is he's a neurogeneticist. So he does genetics, but he really specifies on disorders like epilepsy that are genetic. Because I kept saying, I think she has epilepsy. I think it's epilepsy. I think it's epilepsy. And everybody kept saying, no, there's nothing wrong. There's nothing wrong. So we go in to get our blood drawn, and the doctor just happened to walk in, just passing by going to his clinic. And I was like, I have a question. I said, I know you're a neurogeneticist, but do you see patients outside of the center? And he's like, absolutely. And I said, would you mind taking her on? I said, because I think she has epilepsy. I really think there's a lot more going on, and I need answers. It was like, and I'm hitting brick wall after brick wall. I was like, and doctors are just really nasty.
Yeah.
And pretty much saying that I'm making her sick. And I said, I have 2 other kids. Why would I choose to make one sick out of all my kids?
Yeah, really.
It doesn't make sense. So he was like, no, absolutely. So he started with, he goes, okay, well, we're going to do the genetic testing. It's going to take about a year to get back. He goes, because the whole exome sequencing is kind of new because it was in 2016. So it was still fairly new. Well, we got it drawn in 2015. So we waited, and then he was like, I'm going to send her for a brain MRI. I'm like, okay, great. He goes, and then we're going to do an EEG. So, and she's here right now. Say hi.
Hi.
Hey, how you doing, Isabella?
Good.
Oh, I'm so glad you're able to join us. This is going to be recorded and put on a kind of like a TV YouTube channel kind of thing because you guys are such an inspiration.
What do you think? Yeah? You don't know?
So thank you so
anyway,
much for helping take care of your mom. You guys are taking care of each other. We're really proud of you. If you want to say anything as we're talking to your mom, then you just let us know. But we don't want you to feel shy because we're just kind of friends, okay? All right.
I'm sure she won't be too shy now. So we were getting all these tests done finally. So he got the brain MRI back and he goes, well, he's like, you're right. He's like, her brain scan isn't normal. I'm like, okay, what does that mean? And he goes, there's particular things that we look at in the brain scan and see how the brain's developing. He goes, her brain is underdeveloped. He goes, and for a full-term baby, he goes, with her head size and everything, he goes, that's of concern, naturally. He's like, so we definitely need to do the EEG. So the first EEG, I think, was maybe an hour.
Mm-hmm.
And it didn't, he's like, we had some background noise. He goes, but I'm not sure. We're going to have to do it again. He goes, but we're going to wait a little bit. He goes, because I'm waiting for equipment to come here. He goes, so I can do it. He goes, because it's going to be a little bit more extensive. And I'm like, okay, that's fine. So then the time comes for her EEG, and she had to be up for 24 hours. I could not let her sleep. And I don't know if you have kids, but trying to get a 4 or 5-year-old not to sleep for 24 hours was insane.
Crazy.
So we get there, and they hook her up, and she's there for probably about 2 hours. And he's like, it's going to take me a couple days to go over everything, but I'll give you a call. And sure enough, I think it was like 4 days exactly later, he gave me a call, and he's like, well, you're right. It is epilepsy. The reason it's so hard to catch, he goes, because she's about 10% of all epilepsy patients. I'm like, okay, what does that mean? He goes, So where her epilepsy is not normal. He goes, because it's the back of her head. He goes, it's occipital epilepsy. I'm like, okay. I was like, so what do we do? And he's like, well, we do have to start medication. And of course, my concern then comes in. I don't know if you've if you've ever heard about epilepsy medications, but they're very hard on the body.
Side
And
effects of the seizure medication?
this, yeah, it's very rough, especially for kids that are this young. So he's like, I was like, I want the one that is going to help her the most, but have the least amount of side effects. And he's like, okay. He goes, well, I've got one. He goes, but he goes, with any epilepsy medication, it causes changes in the behaviors, which it definitely has for Isabella. It makes her very frustrated because on top of having the epilepsy, when she does have seizures, for her speech goes. So now she's exhausted because she's had an epileptic seizure, but at the same time, she can't communicate. And then on top of it, she's got the medication in her system. So it turned into her very much so outwardly reacting and becoming more aggressive with her behavior. I think over the last couple years, though, she's tried to tone it down a bit.
So far we've talked about two conditions that have been kind of unfolding with your daughter, and that was the Ehlers-Danlos syndrome, which sounds like was inherited genetically, right? Because you had already talked about your having that too when you were as a kid, and then the epilepsy with her. And so, as you are kind of sharing your story, one of the things that I want for people to be clear is kind of the difference between, you know, what you have versus her, because it's kind of both of you. With you guys have a lot quite going on, right? And on both of you. So with that being established, that you both have EDS, she has epilepsy. What's one of the conditions that you want to talk about next, and who first? So you had brain surgery. Let's start there. Maybe you had brain surgery. Is that right?
Yes.
Why did you need to have brain surgery?
So I have what's called Chiari malformation. So with that, my symptoms were just, I had migraines all the time. But then I would say in 2016, 2017, it picked up to where medications no longer worked. And then I started having gross motor skills, I was losing my gross motor skills walking. I would have moments where I couldn't speak. My vision started going, hence why I wear glasses now. So with the Chiari, it's your brainstem and your cerebellum are pushed through the base of your skull into your spinal canal. And your brainstem controls all of your subconscious function, breathing, blinking your eyes, swallowing. All that is not something you think about, oh, I've got to breathe. So when that's compressed and you've got everything being pushed together, the brain and everything, it starts impeding on your brainstem function. So I became completely bedridden while trying to take care of her. So it went from my EDS specialist, when I finally got tested, I was like, I really would like for you to do an upright MRI of my brain. I think there's something more. They did it. It was like, oh, it was clean, but I got the scan. And I remember opening the scan on my computer. So I took the picture. I cropped out everything and brought it to my neurologist. And I said, can you tell me if you would see this in a person's scan, would you say this is Chiari malformation? He's like, yeah, absolutely. And I was like, okay. So then I took all the editing off the picture and he goes, wait a minute, that's yours? And I was like, yeah. I said, but the radiologist said I don't have it. So I'm not understanding. He's like, no, that's definitely Chiari. We need to set you up with a surgeon. The first neurosurgeon I saw said there's nothing wrong. It's not Chiari. The second surgeon, I actually sent my scans to John Hopkins, to a neurosurgeon there. And he's like, you need a shunt. He goes, because what it looks like is you have an increased buildup, which is where the intracranial hypertension comes from. So my neurologist like, let me do a spinal tap. Let's order that. Let's see where your pressure is at. And as soon as he did the spinal tap, and he's like, you do have increased intracranial pressure. And I said, could that be the reason my vision's going? Because I had really bad double vision. I couldn't drive anymore. I couldn't watch TV comfortably anymore. And he's like, yes, yes, we need to make sure that there's. So with Chiari, when the pressure builds up in your head, you can have issues with the actual optical nerve of your eye. So if that increases in pressure, it would cause permanent eye damage. You can literally lose all vision. So it became
Chiari is
I really
Chiari is kind of a condition where your brain kind of just swells with fluid or something, or
no. So it's an actual deformity in the skull.
okay.
And what happens is that the opening of the base of the skull is way too small. So you have your spinal fluid that pulses through like your heartbeat. Well, because the opening was so small and that my brain had already herniated through, it was cutting posteriorly. It was
Oh,
cutting
too
off the
tight.
fluid from going in or draining,
Okay. So
which was
the
so it
brain
was building. It
surgery
was pretty
then,
essentially causing hydrocephalus.
the brain surgery that you had, that sounds like it was kind of connected with your skull and the size of that it was impacting your brain. So
Right.
how did the surgery? What was the kind of surgery that benefited, that was able to release? Did they have to like take a chunk of skull and kind of make it?
Yes. So they take a good amount of the base of your skull, they take it away and toss it in the trash. And then your with mine, they did the first vertebrae, they cut mine in half. So I'm missing part of my skull and part of my first vertebrae. And then after that, they go into the lining, the dura, which is the protection between your skull and your brain itself. It's the tissue. And they cut that open, and then they place a patch to give the back half of your head, the brain, to breathe so that the fluid can flow. And
Wow.
so for me, it was like literally. So most people with this surgery are in ICU for 5 days. Um, but for me, it was such a relief that literally I remember waking up and I was like, wow, I don't know what drugs you guys gave me because I don't do narcotics because they make me so sick.
Yeah.
I was like, but these work really well. What is it? They were like, we haven't given you anything.
And it just
None. You
you was
asked for
just
drugs.
experiencing relief because you're the
It was, and that's what the neurosurgeon said. He goes, your body has been in so much pain for such an extensive amount of time, your body thinks it's normal. So now that there's a release and you don't have that specific pain anymore, your body doesn't sense surgical pain. And I was like, well, since I'm not sensing pain and I feel fine, can I go home? And I was like, no, your promise was if I felt fine, because I made him promise me that I'd be able to go home if I wanted to go home. I didn't want to be in the hospital because it was just at the height of COVID. So I didn't want to be in the
oh
hospital.
really
And he's
that part
like,
was that recently.
yeah, it was last year. Yeah, I'm only a year out.
And I know that you and I, we were actually trying to get you a lot earlier, right? We've been in contact. I know
Yes.
that we started back around 7 months, and I'm not sure if your and I's communication goes back that far, but I know that we had to push it off because of some things that you were going through,
Yes.
right?
So with the mast cell, I have to have a central line. So I had a portacath that was here. Well, with that, because I did move to a whole new country, and here in Ireland, portacaths and central lines are really only reserved for cancer patients. They were kind of taken back by it, but I got an infection in my line. So whenever you get an infection in your line, you run the high risk of getting sepsis. which I ended up
did you
getting.
move to
That's why I had to cancel.
Did you move to Ireland because of the care that you were going to be getting there?
Kind of, yes, but I'm originally from the Netherlands, so I wanted to be back in Europe.
Oh, okay.
With Isabella's with her genetic disorder, it was just better because the Netherlands and Germany just has better genetics than anywhere in the world. So the three leading countries right now for genetics is the Netherlands, Germany, and the United States. So for me, it was I wanted to be back in Europe. I wanted to have access because there's a medication trial that they didn't have in the US that they have in the Netherlands. So I wanted to be here for her treatment.
Okay. And you start getting
So it was
into,
kind of both.
you start talking about mast cell activation syndrome, and that's also something you both have. What
Yes.
what are some of the symptoms if you were to just describe somebody just brand new, like what's kind of basically going on in the system that's even a problem?
So it's basically your histamines just overreact. So there's two different disorders. There's mast cell activation syndrome, which is what I have, which is more prone in EDS patients. And then there's mastocytosis, which is easier to diagnose than MCAS is. So essentially, your body just surges with histamines, and it could be random. You could not know when it's coming, but it reaches anaphylaxis. So it's like people with food allergies have to carry EpiPens. People who are allergic to bee stings have to
Oh,
carry
that's right.
EpiPens.
It's just a sensitive kind of reaction, kind of a thing, right?
It is, but it's more serious because for us, we don't know what we're going to react to and when we're going to react to it.
Okay.
So it's drawn out to get diagnosed. They do bloods while you're not having a flare, bloods while you are having one, and then bloods again after a flare. But then you also have to meet the clinical criteria, which is we call it a butterfly rash, and it's flushing of the face. You will get redness in your cheeks, and it'll feel hot. And then some people, like I, get really bad hives. I mean, so significant to where you actually have to be hospitalized because it can cause tourniquet syndrome, where the swelling is just all around an appendage and it will restrict blood flow and you could lose an appendage. And then there's the anaphylaxis. But we want to prevent that. So, in order to be able to prevent that, you have to be on antihistamines around the clock. With the added gastroparesis, oral antihistamines no longer worked. So, it was just better for me to be on IV antihistamines because A, I can give it quickly. It reacts a lot quicker because it doesn't have to be absorbed through the stomach and through the
Mm-hmm.
gut. It's straight into the veins. But it's hard to diagnose, but it's a comorbidity of EDS. So usually if you show a person who has specifically Ehlers-Danlos type 3, which is the hypermobile, which is what I have and Izzy has,
I would
it's more
imagine that
common in us.
they're, especially with CRPS, central regional pain syndrome, being a similar condition in terms of causing that, if the flushness of color and different things. That's something that Nell deals with. Boy, just so much to still learn, I think, with the experts, right? As they break all this down and kind of understand what is and what isn't happening, and trying to make sure that they've got proper diagnosis to not confuse and say, oh, you've got this instead of that. And then, of course, bedside manner, right? In terms of just treating you good.
Yeah, bedside manner is a huge thing.
Yeah, I mean, it's sometimes that's extremely, uh, important in someone, being able to recover, is just whether they have that connection with the person that's giving them care. And,
Absolutely.
let
Absolutely. I mean,
alone,
I have fired many doctors.
yeah. So there's
And
two,
especially when it comes to, your Hmm?
there's two main question marks as it pertains to just kind of your conditions, and then I want to kind of maybe talk about just kind of what day to day is like as you've learned to cope with all of these things. So we haven't talked about Larsen syndrome or Chung Jansen. So Larsen syndrome you have. Let's start with that, and then we'll
Yes.
get to the Chang Jansen who your daughter has.
So for me, there's not much known about Larsen syndrome. My mutation, it's been around a lot longer than Chung-Jansen syndrome, but there's only 59 people in the world with my genetic mutation for the Larsens. I know that I was born with a club foot, so that's one of the things. So it's also connective tissue, just like Ehlers-Danlos is, but it also causes skeletal deformities.
Larsen does.
So it's kind of we really Larsens
Is that what
does,
you're
yeah.
talking about right now?
We really don't
Larsen,
know.
right?
Yes. And we really don't know.
Okay.
I have not found a provider that knows anything about Larsens.
That can kind of give you insight. So that's something that's still your. Well, then let's talk about. I'm going to kind of look up while you're. How did you even come to know of that name? Did someone say, "Hey, this is what we think that you have"?
Genetic testing.
Okay.
It was through genetic
So it
testing.
says here, I just searched it. It says Larsen syndrome is a disorder that affects the development of bones through the body. Some of the symptoms: spinal deformity, such as scoliosis. So you had mentioned you also have
Right.
scoliosis. Foot disorders, dislocated hips, short stature, abnormality, loose joints, extra bones in the wrists and ankles. So not all of them are going to apply, right? I mean, I suppose if somebody has scoliosis, they have to some degree Larsen syndrome, right? Because that's kind of part of what creates scoliosis.
No, because so with scoliosis, there are many different diseases
Kinds,
that can cause
okay.
Scoliosis.
But that could be part of what causes scoliosis. So maybe,
but it could be
maybe
part
not
of
everybody
mine,
with
but
scoliosis
and that's
has
where
Larsen, and we're no
the
experts,
doctors are
right? We're
kind of
trying to
like,
learn here, so
right, and it's why the doctors were like, we don't, because I'm so unique, because there's only one other person that with Larsen and EDS, so there's only two of us in the world with both, and we've kind of gotten contact, and they're in the same position I am. The doctors are kind of like, we don't know what to do, because one genetic disorder that's disease causing is rare enough than to have
with
two.
Larsen, you said
And
that level of rarity is with Larsen and what?
With EDS, the Ehlers-Danlos syndrome.
That combination.
So just having a good, yeah. So with anybody, like everybody has, when you talk about genetics, everybody has some sort of genetic mutation. What it is if it's a disease-causing genetic mutation. So then it goes back to, okay, well, and they don't do studies unless they have over 100 patients. So they don't do studies. They don't really, it takes one doctor to be like, okay, yeah, I'll dabble in it to give you some information. But aside from that, that's as far as it goes until there's more people diagnosed.
It's not a priority. I mean, they have to prioritize.
It's not a priority.
Yeah.
Right. Right. And it's why with the Chung-Jansen syndrome, like with Isabella, she's rare too, because when she was diagnosed, she was patient number 3 in the world. So as a mom, my automatic thinking is I want to know all the other patients. Like, I want to know who's doing the research, who's doing what. And when they gave me her diagnosis, I mean, I remember sitting there with the doctor and he's just like, literally, here is the journal printout that we have. There's been one study done on it, and it was done in 2016 when she was diagnosed. It actually came out 3 months prior to her diagnosis. And I was like, okay, well, what do you know? And he goes, literally, this is it. And it was a blep in a medical journal. So
now this is where we start getting into where you had some feedback from folks, and even though the term that they use as they were trying to just talk about some of the developmental impacts, and they used a derogatory term kind of a thing. So aside from that, which is insane, and I'm sorry for that because you shouldn't have
It's okay.
experienced that
It's
at all. The Chung Jansen condition is what gets into the delay of development.
yeah,
Okay. And so
right,
they were, I mean,
right,
even if they were well intentioned, right, giving them the benefit of the doubt, even if they were well intentioned in that they're trying to kind of explain that yes, there's some legitimate developmental um, challenges that are happening there that's different than like your Down syndrome or something else, right? Um,
right, right,
that's what they were at least starting to lead into, right? Is that they were
right.
acknowledging,
I mean, they were on the right track,
yeah,
and it's funny because I remember because I used to work in the medical field, and I remember like our big, the big boss was always like, it's not what you say, it's how you say it.
yeah, oh yeah, yeah,
And
yeah, and he
for
could have.
me,
I mean,
had they presented it like, I probably wouldn't have gotten angry and I probably wouldn't have fired him had he come at me with, look, you're right, she's delayed, we need to investigate. But it was just
yeah,
this is what I
exactly.
think it is, have a good day.
Yeah, I could absolutely. I
And
think that that's pretty realistic to expect to say. Now, we're sensitive and that we too observe that there's some developmental challenges that are happening, and here are some symptoms that we're recognizing. There's a number of things. I mean, look, I'm just some layman guy, right? I'm off the street and I'm trying to give an example of how you can phrase something, right, that I know nothing about. But I mean, I could see that expert saying these are some of the symptoms that we look at with any kind of general developmental challenges, so we know that that's going on. Now it could
right,
be a number of different things and we're not quite sure, so here's some of the things that we know or don't know, or some of the things that we can kind of look into so that we can try to get you a little bit more
right.
information. And then if there's any testing or whatever, right, if it's
Exactly.
yeah, I mean, if it's created, if they have a little bit of knowledge of how of Chung Jansen, they say, now some of the symptoms that this falls into, that we sometimes see is this condition called this, and here's a pamphlet that you can kind of learn into it. It doesn't mean that we've
Right.
gotten a formal diagnosis yet, but let's go ahead and spend some time to maybe observe things even
Exactly.
further, and we'll have you back. And meanwhile, I'll talk to my colleagues, and we'll kind of see if we can't kind of pinpoint something to you.
Right.
Very
This
different
guy
than
just didn't want
just,
it.
oh, your daughter's a blank blank blank.
Right. Right.
Absolutely
I
insane.
mean, I feel very blessed that we were able to grab the neurologist that we did because that man, I mean, there's doctors, but then there's doctors who are doctors because they truly care about patients and patient welfare and other people. And like, we still talk to him. Like, I still call him, like, hey, this is what's going on. Any suggestions? And I'm in a different country. And he's more than willing to pick up the phone and talk to me. He's more than willing to email me, you know?
Yeah,
But he made it a point to being like, look, I'm here. I understand what you're going through. You're not wrong. You're not causing this. There's something wrong, and I will try and figure it out. I can't guarantee you a diagnosis, but I will find out as much as I possibly can and give you as much resources as I can.
exactly.
Which he did. And it's, with her condition, with the intellectual disability, I have to say this. He pre-warned me. He goes, there's usually no genetic connection between intellectual disability and a genetic disorder. It's very rare. He goes, so if there is a connection, we will find it. But if there isn't, you're gonna have to come to terms that this is the way it is, and that is how she is made. And I was like, you know what? Okay,
So be it, yeah, because
I'm fine
a
with
lot of
that.
these things that we've talked about, you've got one to one kind of correlation in that. Okay, in terms of the answers, something I have as well. I can see that I have it. That rings true in terms of what my life experience has been. This is a benefit in that
Right.
we're hopefully going to be able to have more education for Isabella and help her to, have increased coping skills and an understanding, having it be
Yep.
constructive for herself in terms of not feeling isolated or feeling like that there's something wrong with her compared to the other kids. Sometimes previous generations, when they didn't know what was going on, didn't have that benefit, right, of being able to feel like that, hey, I can be myself, and this is what we understand about it, and I'm just as good as you, and let's be friends, kind of thing.
I mean, if you really think about it, less than, I would say what, maybe 60 years ago, kids like her were institutionalized.
Yeah,
They lived
yeah,
in an institution their whole life.
yeah,
They were not allowed to be part of society.
yeah. They were just the
So
misfits. It's kind of like the unknown. We don't know, but you know what? The shameful truth is that we really care? I mean, because if we just kind of put them aside, there's all these people that have health, and we've got answers, and we're just trying to live the best life. We don't want, as part of the equation, to try to be inclusive of all of this stuff. Yeah, it was pretty bad.
I think with Isabella, my main concern was we didn't know what it was. We didn't know life expectancy. So for me as a mom, it's what can I do to make sure she has the best quality of life
Yeah,
and make sure that I give her the most life that I can give her.
yeah,
I'm very fortunate that her disease is not life limiting
yeah,
in the sense of it's the disease that's going to kill her. It's not. Now, the comorbidities can, of course, because it does lead to genetic obesity,
yeah,
diabetes, the epilepsy can, with a lot of people think, oh, epilepsy, you take meds, you're fine, but it's not that way. You can take meds your whole life, and it takes one seizure to completely ruin you, and you end up dying. So
yeah,
for us, it's always, let's make sure she's good. Let's make sure we're doing everything we can. And I think having the neurologist, the neurogeneticist doing the testing, finding out what's wrong, it gave me just a little bit of the puzzle, but enough of the puzzle to where I was, I went into my medical training mode. Okay, I'm going to read this. And then I looked at everybody's name that had their hand on the paper, and I started making phone calls. I saw that you wrote this paper. My daughter was diagnosed. What can you tell me? And it happened to be a molecular geneticist, Dr. Chung, in New York. And I remember calling her office and leaving a voicemail. And she called me 3-4 hours later. And she goes, yes, I'm Dr. Chung. Yes, I did the study. But we need you.
and it was
What do
named
you need
after.
from
That
me?
was partly named after her.
Yes, yes. We actually got to name it. It was me and another mom. And we decided to name it after the only two doctors that are studying the disease, which is Dr. Chung in New York and then Dr. Jansen, that's in the Netherlands, who we're going to be going to see. We had a huge hand in it. In fact, Isabella's actually
Okay,
in
let me just back up for a second. You're saying that you have medical background experience. You're in that profession, and you were part of the naming of this condition. Is that what you're saying?
Yes. In fact, if you look up her condition, my Facebook group that I own, me and another mom made. So new patients that are diagnosed will go to a genetic counselor, and they will actually hand them the paper with our Facebook group on it for them to come in, and we as parents and patients discuss and notate all the symptoms that everybody's having, and we try to make up a list for Dr. Chung and for Dr. Jansen so it helps them better understand the disease. So when it's something so rare, as a patient and as a parent, you become a tool for them.
That is so amazing, Louise. I mean, aside from just the inspiration, that is such pioneering. I mean, you are part of helping provide the need and the leadership in an area that if we didn't have people like you would otherwise have a void. And when there's a void like that, then you have conditions of earlier generations that perpetuate, like you mentioned, right, that have just been inhumane.
Yeah.
So this is pretty significant with what you're involved with, not just in that you have
And
gone through it. I'm sure you've came to your own personal um, conclusions and realizations that it's just not in vain. It's part of a very bigger purpose, right? For and that this
it
is
is. We
and
feel, we just feel that we were so in the dark. And I think it's so funny because the article that I read, so it's the first article. I had a picture of a little girl, and I was like, oh my God, she looks like Isabella. And I may cry.
that's okay.
And
It's
when I
amazing.
made the group, the mom is now in our group, and I didn't even know it. So I remember her name. I remember her daughter's name. And I was like, wait a minute, was that your daughter in the study? And she's like, yeah. And I was like, I don't think you understand what you did by allowing your daughter to be photographed and put into the medical journal as it, because it didn't just give me a face, it allowed my daughter to see that she's not alone.
Yeah, that she's
And
not
that is
alone.
so significant.
Huge.
She's not alone. She has a face, and now she actually gets to talk to this person live and in person. And we had made the decision pretty much right away when we found out that, since there wasn't a lot known, we wanted to make sure that as much as the doctors could learn from us, we were willing to do.
Yeah.
And so in 2018, my daughter was published for the Chung-Jansen syndrome. If you look it up, and if you look at Kristen Murdoch, Chung and Dr. Chung wrote a paper, and you actually see my daughter's picture. And I did it not, and usually I'm very private with my kids,
Yeah.
especially because I've had a lot of, disgusting people. People say, the worst,
Yeah,
most
it's sad.
disgusting things.
There's a lot of craziness in the world.
But because this woman allowed that to be done for her child, and it helped me, and it helped my daughter,
Yeah.
figured maybe this could help somebody else. And now I'm seeing other people like, oh my God, like having you be a real person, somebody we can talk to.
Yeah.
Seeing your daughter, like, it's a help. It makes us not feel alone. So it's kind of, once you get into, rare diseases like that and stuff, you learn from each other and you grow with each other. And it's just, I mean, we've grown. I remember starting out in 2016 with just 2 people, and now our Facebook group is almost at 200,
Yeah.
which means now we're finally able to get into medical trials, which is why we came here in the first.
That is such a big deal.
It
I am
is.
so
So
excited
we
for you guys.
finally, last month, we made contact with the research team in the Netherlands. So they're like, yeah, absolutely. Let's talk. So I've got a meeting next week with them, and we'll be flying to the Netherlands to get Isabella, finally get her on the medication she needs to be in on
Wow.
for the genetic obesity aspect of it.
Yeah.
Which is, for us, it's huge.
Yeah.
And I let her choose. Like, if she doesn't want to do the trial, she doesn't have to. But she's at the age now where she's 11. She's understanding that she's overweight and she's bigger than the other kids. And it's now hitting self-esteem mode where, like, oh my God, I can't eat this. Oh my God, I can't do this.
Yeah.
But just like Trader Willie, their brain doesn't tell their stomach they're full. They don't have the correlation. So she knows she's going to have to get injections done every day. And she goes, Mom, if it helps another kid, I'm okay. And that's huge for me.
Wow. How mature.
I'm trying not to cry.
Oh,
I'm really trying not to cry.
Amazing. That is such an angel.
I think
Louise, that is so amazing.
For her aspect at such a young age, that sometimes you have to do things that hurt or go through things to make other people not have to go through them.
Yeah.
And for her to grasp that that's what she should do and is willing to do it and puts a smile on her face to do it, for me, it made me feel like I did a good job as a mom.
Yeah, well, just a proud mama moment for sure. Out of all of them,
Yeah, she's definitely a good kid, but it's just, I mean, with both of us having such rare diseases, we kind of have made it a point to try and get it out as much as possible because
yeah,
there are people in the world that access to these tests that are suffering, or doctors are telling them that crazy,
yeah.
and if it
Well, I
wasn't
wanted to I
if it
wanted to
wasn't for
mention a couple
her,
things. Nell, when she kind of started her dream early before we even started interviewing people, just wanted to just reach out to just anybody, right, in pain and isolation, and that's what our goal is just to keep, till the day we die, to just keep try to spread this throughout the world and keep at it. And if you take the millions of people that have just some kind of chronic condition, right, some type of chronic pain, even though there's that big of a number, but they at least have in common something that is different, right? That
hmm
even that big of a number,
right?
there's so many people that have high numbers of similarities of people all throughout the world that they just are unaware of, and they themselves feel isolated, right, and alone. And over 50% of the suicides just in the United States is chronic pain, related. So you
Yeah,
take that, and within that whole space, even if just that percentage of those people talked among themselves, and it started becoming more normalized and of part of conversation, it's less stigma, or there's more inspiration, stuff like that. What
yeah,
today helps to illustrate is that even within that high of a number, there's pockets of way smaller percentages of rarity.
yeah,
And
right.
so if it's already a problem with people that in the grand scheme of things really have a lot of people that they can connect with and get support with and get the benefit of feeling supported and this and this and that.
Right.
I can't imagine the degree of difficulty for individuals like you and your Isabella and others, where there's not only less to connect with, but that there's bigger voids involved. And instead of being able to
Yeah.
look to people in society that already have that kind of set up that can help to change some of that to where it's known maybe to be more, less rare than maybe you're originally thinking or whatever. There's not
Right.
a lot of progression in that area. So what are you gonna do? I mean, it's your daughter, right? You're passionate about. You're gonna step in to those roles that are needed, and be the people that the next generations are gonna be looking for. Who's representing me, and I'm sure that when you was kind of going through your life, it wasn't like you're like, hey, sign me up for that, right? I mean, this is not maybe what you had planned to have as your
No,
life,
definitely.
but you find yourself, whether that's finding that it's because of a purpose, a greater, grand scheme of things, whether that is being propelled by love, and you're just going to do whatever you're going to, do for your family and your kids. You step up to the call, and that's what I think that you
Absolutely.
have absolutely illustrated here. And it's, again, it's not only something to be commended, for everybody that is in any kind of a percentage of people that are just dealing with this, where they're feeling like they're on kind of the sidelines. But wow, I mean, I'll even put that out there even more so for people that where the percentages are like the lowest of those people, where you literally
Yeah.
feel, even after years and years and years that maybe I really am the only one, right? Or maybe just me, you know.
Yeah, and I think that's, especially when, I found out, like, wow, there's only two other kids. Like, there's got to be more
Exactly.
people.
Yeah.
Like, for me, when I met up with the other family, when I got to talk to them, it was, it's like, so I usually say it's a club that you never want to be a part of. But once you're a part of this club, you can't see your life any other way. Because within being rare and having doctors look down on you like you're crazy or whatever, you have this just overwhelming, like, no, you're not going to do that to me anymore, and you're not going to be able to do it to anybody else. Like, you learn really quick how to advocate.
Yeah.
Within that, you learn to advocate for yourself, you learn to advocate for family, but then you learn to advocate for other people.
Yeah.
And I think for me, hands down, like, that is what my purpose is.
Yeah.
Like, before Isabella, I was just like, I really don't know what to do.
Yeah.
I dabbled in the medical field, I do art, like, I have all these different interests, but I could never pinpoint something that I really, really cared about. And once I had her, and once, like, I just saw the disparity, I was like, this is not okay. Like,
Yeah.
if I don't want my child to go through it, I don't want somebody else's child to go through it.
Mm-hmm.
And I think as a community now that we have, with amongst ourselves, because, everybody has a different background. And it's, we have some people whose kids, these people are, one of them's, a physical therapist, occupational therapist, and they're dealing with this with their children. But we're together dealing with it. And it's like, even though these people have a connection to the special needs community, they still felt isolated until they
Yeah.
were able to meet up with other people. So
Yeah.
for us, it was huge.
Yeah. Oh,
And
yeah.
it dribbled
I can't
into,
imagine. And then the other thing that comes to mind, other than kind of those percentages that we're talking about, and this is also telling in terms of what our hope is the absence or some of the limitations in the outreach globally. I mean, some might argue that connections are happening, whether that's on social media or whatever, in the United States, and then you got your Canadas that are kind of connecting, and here this is our
yeah,
first interview out of several, and we're booked through July of 2022, and we're doing 4 interviews a week now. And we're starting to see, this is going to be the first of others where we're reaching out, right, and making those connections across the globe. And who knows whether or not that means that even circumstances like yours, although you want to validate the fact that they may still be more rare, right? Is there something to be said about the possibility that there's maybe more than we know, than any of us know?
absolutely.
Yeah.
There's absolutely, I mean, I see it with the Janssen syndrome. The most, the, when you look at groups in terms of the world, most of the patients are in Europe. Why are they in Europe? Because in the Netherlands, for instance, you don't pay for genetic testing. As soon as they have an inkling that something is wrong, they run a genetic panel. Whereas in the US, you have to fight to get into somewhere and hope to pray that somebody pays for it, because these tests run $150,000, $200,000, $300,000.
Yeah, the insurance.
Normal everyday
Yeah.
can't afford that. And unless you have a valid reason and push with insurance in the States, you're not getting that test. So do I think absolutely, I think there's a lot more people out there. And I think and it's something that I've done too. And I feel blessed because of TGen. For instance, they allow parents to speak to incoming surgeons, specialists. These are people that have already passed medical, just to be a regular doctor
Yeah.
that are now going into specialties. And I remember going into it and I remember telling them, I said, you are first contact sometimes. I said, sometimes you're only contact. I said, but the thing that you need to remember is we are people. We aren't a disease. We are people. And listening to us and understanding what we're saying
Yeah.
is going to give you everything you need. But shutting us down, making us feel like we're crazy is not okay.
Yeah.
I said, I don't know how many doctors I had to literally get into screaming matches with over my child, telling me that I'm crazy. I was like, and then to find out that no, there is something wrong with her.
Yeah.
I said,
Well, what
the pain and the
validation?
terror you guys cause. Right. And it's so funny because you know what I did? The the neurologist that told me that I was making her sick and that she was just fat, I sent my daughter's genetic test to her with a letter. I hope you quit. You should not be you should not be in the medical field, and you should definitely not be in pediatrics.
Yeah. Well, I mean,
And then I find out
some people will be coachable and they can acknowledge moments where they were wrong, and all the more power to them, right? We need people like that that can acknowledge. But
right.
there are some that would respond to that and be like, and they need to be in a different.
There was no response. She ended up retiring. But the best part about that is her husband was my daughter's rheumatologist who told me something was wrong.
Say that
They were
again.
married, and I had no.
Her
So the
husband.
neurologist that I didn't like was my daughter's rheumatologist's wife.
Oh, really?
So when he retired on his last visit, I found out that that was his wife. And I remember, and I said, I love you. I was like, you've been amazing to us. I was like, but I didn't know your wife was a neurologist. He's like, oh, yeah, yeah, she works at this hospital. I was like, yeah, I know. I was like, she's a bitch. I was like, I'm sorry. I don't know how you deal with her. I said, but she should not have been working with children. And I explained the story to him. And he's just like, I am so sorry had I have known. And I said, you don't need to cover your wife's butt for being a jerk. I'm
Yeah.
just letting you know so that you can go back and tell her that you knew something was wrong with my child and that she was in the wrong since
Wow, how
she
ironic.
retired and I
How
couldn't.
ironic to experience something so
Oh, yeah,
polarizing like that with the same couple, you know.
yeah. He was an amazing doctor. I mean, our first appointment with him was 4 hours long. How many
Yeah.
people know of a doctor that would sit with a patient for 4 hours
Yeah.
and then tell me to go get tested and diagnosed because he knows I have a genetic issue? If it wasn't for him and then the neurogeneticist, I wouldn't have anything. I would still be wondering what's wrong with my child.
Yeah.
So I told him, I was like, forever,
Well, this
you will eternally be with me in my heart. Like, I can't thank you enough for helping. I was like, God,
not
I am
only
so sorry you
not
got to
only
be
is
that
all
woman.
this educational and inspiring, but it's encouraging for me. You know, you're in a situation that I oftentimes am not able to kind of talk about in terms of the rarity of what you're involved with, and and some of the potential for next steps to expand what you're doing. You know, having people connect more globally, um, that we can unpack, all day long in terms of all the benefits that come from it. But it all comes down to, and we say this, so often in our interviews, in that what makes this life still not just copable, but that can actually be a good quality of life is with it, us all receiving grace, and with
Mm-hmm.
learning how to cope, because we can't just solve and fix, and we try to do those things as much as possible, but we're always all left with that reality that we have to cope, and that's sometimes really hard to accept, but we're just so much stronger together. It
Definitely.
I don't know what the guess would be that if we continued these kinds of things and it was just the norm throughout the globe, where there was
Hmm.
just way less isolation, much more connection, all these kinds of things, I wouldn't even know what to guess of what the suicide rates, for example, would just drop in the US or let alone globally. Because I'm sure it might even be higher around the globe, in different parts of the globe. But
Yeah.
and one is too much, but goodness, can you imagine if all of the people throughout the world that have interests like you and I and so many others of sharing their stories and filling those voids when we need to, in terms of kind of stepping into those roles and things. If we were part of helping, oh, I don't know, let's say in the course of like a year, 2 years even, you know, reducing the percentages of suicides alone by 50%. I mean, can you imagine?
Yeah.
And so I can't overestimate enough, and want you and those that are
No.
watching this for to know how much you and Isabella mean to us, how extremely inspiring it is of what you guys have had to go through, and I'm really optimistic that not only are you going to continue to influence the progression of some of those next steps in your own life where you're at in the part of the world, but in whatever way that can influence, by just that recording being on YouTube, and for you and her, and talk with Isabella in terms of what that means, and that is going to stay there, right? No matter what you guys do in your own circle of influence, this interview and kind of explaining a lot of this, that's recorded and that's out there, and it's going to help a lot of people over the years as they watch that and they come across that for the first time. And so I just want to thank you, so sincerely. And I know Nell would love you. You remind me a lot of Nell. She's like she likens herself to the panther animal. She is a panther, and boy, you're a panther, Louise. You get in there and you're like, I'm gonna make this happen.
It's so funny. Like I think a lot of people that like knew me like prior to having kids, I was very timid, very shy. And now that I've had all these experiences, I'm kind of like, no, 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 this is not what's going to happen. I'm a lot more boisterous with my voice, and I'm a lot more, because you're a parent. It's your loved one, and you
Yeah,
don't want to see anybody go through that. So
yeah,
it's kind of, you kind of make it a point to like, no, there needs to be more awareness. And it's, not just rare diseases that need awareness, mental health. For instance,
exactly.
the United States, like there's a huge difference. When I came here to Ireland, mental health is taken so seriously here. It doesn't take but a phone call and you're going to get the help you need. Where in the
Really?
US, it's still such a stigma, so taboo still in the US, that it's, you're losing so many people to mental health in the US when it's all avoidable.
Yeah,
These are needless deaths because the stigma that if you're mentally not capable of dealing with certain things, that there's something wrong with you, you
yeah.
need to just
Something to be
get over it.
ashamed of, or something to hide, or
Right.
whatever.
Right. And it's same with pain patients. There's a war on pain patients. People with, you know, the, uh, chronic regional pain syndrome. You know, there's people out there that don't have access to, important medications anymore because this whole war on drugs. No, it's a war on pain patients, which is not talked about enough. It's just not.
Yeah,
When you come to a different country, like you just realize these aren't normal things. Like, why are you punishing the sick and the disabled for things that they can't help, but yet at the same time you're enabling somebody with an addiction?
yeah,
Like, it doesn't make sense to me. You are punishing those who rightfully need medication and enabling those who abuse medication at the
yeah,
same time.
yeah. There's
You're
a
not just
lot
going
of
to pain
sorting
patients.
out that for sure. It is. It's true. I mean, even though there's positive things that are happening, more positive conversations, stigmas are getting broke down and things like that. But boy, you're right, and that it's a sobering reminder that there's still, not just in the U.S. but around the world, just so much more that needs to be done. And
I mean,
you're
what is it
certainly
within the last like, 10, 15 years? They realized that addiction is an actual disease.
disease, yeah.
Now they're realizing it's an actual disease. But at the same time, there's so much that once you get into, you know, people with medical conditions, that you realize that as a person who before didn't have anything and didn't realize the medical world, you are so blind to that now when you look at it, it's just like this is not okay. Like why aren't more people speaking out about this?
Well, the
No,
world
why aren't
the
why
world
are we
is too um, judgmental and not compassionate enough and grace.
absolutely
I mean, not to oversimplify the problems of the world, but if I were to say one root problem that's beneath it all, is that people, as they grow up and they lose kind of that innocence from childhood, they
yeah,
discover I'm in a world of judgment rather
yeah,
than I'm in a world of compassion, of
right.
of grace, of forgiveness. I mean, can you imagine how big of a difference that alone, of just of how we treat one another
I
with all of
can.
this?
Since I've come to Ireland, the dynamic here, people here are so
Is
different.
different. That's
A
interesting.
simple thing. It's literally, I have not come across somebody that's just been an asshole. Nobody has. And
Really?
we didn't have internet. So we were lucky. There was an American family that lived in this house before us who got us in touch with the landlord. But she still had
Hey,
friends
Tracy.
here, found out we didn't have internet. One of the neighbors knocks on the door. I don't know this person, never met this person, never talked to this person, and handed me an internet box. She's like, "Here, I heard you needed internet." I'm like, "What?" I was like, "How much do I owe?" She goes, "Don't worry about it. When you guys are able to, get sorted with, getting a bank and getting utilities, I'll come back and pick it up."
Yeah. Oh,
You don't
there's
see that in the US.
there are people throughout the world, this whole idea of this nation is the most superior and this nation, and it's really nonsense. I mean, yeah, you want to have pride and you want to be a patriot, and I completely get that. But the reality is that there's amazing people in every country throughout the world, and there's always something somewhere that you can benefit from. There's never a justified reason to have your pride go to a fault to where it's actually kind of like that puffed up pride, right? I mean, absolutely,
Right.
you want to be proud of where you live and your people and things, but yeah, I mean, you give some good reminders, and that they're that's the right thing to do with anybody in any country, whether that's a leader or a citizen, is to just be humble and be like, hey, what can we learn from these great people over here, right? And vice versa.
It's absolutely free to be kind. And you know
Yeah,
what? Nobody's going to get mad at you for being kind.
yeah,
You know, if that happens, then obviously it's more of a personal issue on their part. But I mean, the dynamic here is so different, more family oriented.
yeah.
You know, people spend time together. They also have a different work ethic here than they do in the U.S. You work 5 days a week. You have mandated days off. You hit what I think it's 65 or 68 here, and you're forced to retire, not work
You
anymore.
you keep
You
going,
have,
you're gonna make my wife want to move there. She loves Outlander. She loves her island. She
and
I served a Christian mission in England, so I've spent some time in Wales and Trowbridge and Bristol area, Yeovil. So I have a love for over there. I really miss the double-decker
I mean, that's
buses and
not
the green.
represent anything. Healthcare is a little lacking here. I'm not gonna.
Yeah.
It's behind. I mean, we're talking about beds from Andy Warhol. I mean, there's some things, you know.
Yeah.
But as far as the people, they're very welcoming, and it's something that I missed being, Netherlands. It's something I
Yeah.
missed that I didn't have in the States. It's the feeling of being in a community, even though we are outsiders. We were very welcomed and very
Wow.
appreciated, and even with like I see a nurse every week to get my dressing changed on my center. Even they're like, how are you feeling? How are you doing? It's a genuine, how are you feeling? How are you doing? Like they're asking you until you open up to them and tell them how you're doing.
Yeah, they're
And
personable.
it's very different.
Yeah.
You have, it's my husband compares it to being back east in the 80s, 70s and 80s. Where you got June Cleavers at home,
Yeah, yeah.
it's very like here still. Whereas now in the States, I mean, even with my kids going to school in the States, they hated school. It was a drag every day for them to go. Now that there's my son,
Yeah.
he absolutely loves it. Like, Mom,
Well, people
nobody's not.
throughout, yeah, I think that what a good message, and that there's always opportunity to have people be examples that we can look up to. You're certainly, you know, and your family. I don't know your husband. Give our love to him, and that's a whole other story to unpack right there, and we get that. So send
He stays in
our
the
yeah. But you guys are just amazing, and it's just been an honor and privilege having you. Um, we'll continue to stay in touch. If I don't already have your
back.
address, I'll need that because we're going to be sending Christmas gifts out here to people we've interviewed in a bit. And we also, what we started is at least whether it's once or twice a year, you'll get a Zoom invite kind of information, and so people that we've interviewed all kind of join this big Zoom, and we just kind of have a powwow, big hug kind of thing. So, yeah, you are
Yeah,
you
leave
are
it
part of the family.
far.
I'll continue to follow you, and if there's anything that we can do for you, let us know. Hopefully, if you can more connections, people that aren't, if you're not following that sick chick, please do. And vice versa. So people that have followed us, we've become really good friends with and things, and so we just love to continue. Especially, again, I'm just going to say that because it's kind of a big milestone, my friend, and that this is our first international interview. I mean, not to dismiss Canada
And I
and going out
definitely
of the
have some.
United States, but this is
I
our
definitely have a few
first
things that I'm missing
over there in Ireland,
too later
and we're going to be talking to Australia. We're going to be talking to UK. We're going to be talking to Scotland. We've already got interviews set up, and so you guys are famous over there, girl. So Louise and Isabella, I want to just thank you so much because you're going to be doing. I know that you're doing a lot for a lot of people with where you're at in this part of the world, but I just want you to know that the recording that goes to our YouTube page, people are going to be able to go and listen to and just be helped as if they're watching it for the first time. So you keep doing your thing and not just taking care of yourself, but also your mom and your family, and you keep being an example to those kids and help teach them how to treat each other and to love and accept each other, because that's what should be happening. And if they're not always doing that, you can be a leader and help teach them how to behave towards each other. We're just so proud of you. Okay?
Say thank you.
You're
Are you
welcome.
glad that he asked? Yeah. Even though you left. I think she's very appreciative, as am I, because I think that what you guys are doing is such a huge thing, and I think it needs to be done more. I'm sure I'll be sending you a little note here and there with some ideas that I have that maybe you guys can help with, as far as, just I think it's important that people don't feel alone.
Yeah.
And you definitely have made us feel like that. Yeah.
Yeah, you keep us posted. You keep us posted on what's happening in that part of the world, you guys, because you're really doing an amazing job representing what Nell and a lot of people are trying to achieve and have joined us in helping do that. So thank you so
And I think
much for
you guys,
joining us.
they've done an amazing job, right? She's over it. She's tired. It's almost 10:30. She's exhausted. She just wants to go to bed, just not in my bed. You got your,
Yeah, go get something to
but
eat. It's late. It's late for where you guys are. Thank you for being accommodating with a little bit of the different schedule. People are going to be pleasantly surprised that I had a live at 2 o'clock on Saturday. That was probably a first as well, and they'll find out that that's the case once I upload it. But anyway, I can't say enough how much we love you guys and
we definitely,
how much we appreciate all that you're doing. And thank you for joining us today.
and we love you too. We appreciate you, and definitely we'll send you an address, and we want an address too, because I'm sure we're going to be sending some cards and stuff as well. But thank you so much for what you're doing, just for the, for us in the medical community. You know, it's, I don't think you understand just how amazing it is to have somebody else in their platform use it to help us get just our stories out there, that there are some of us out there that we're still fighting, even though we have diagnoses. There's other people that don't, and it's awesome to be able to share it with other,
Oh, well, thank you.
especially people that just have no clue that there's people like us out there. So
Yeah.
it's awesome for us, and we appreciate
Absolutely.
it.
You guys have really touched me today. I'm going to have a better day because of this interview. So I'm blessed. So
Yeah, we always smile, right? We don't do frowns, we don't do sad faces, we smile, because if we don't, it just makes us have bad days, and we don't like bad. Yeah, we like good days, so we smile over
yeah.
here. All right, well, you have a good one. I think I'm gonna put her to bed. My other one's crying, so
You
he's ready to go to
gotta
bed. He wants.
take care of yourself. I'm going to enjoy cheering you on, my friends, okay? Okay, we
Thank
love
you.
you so
Tell Nell we
much.
love her.
Okay, I will.
Better soon.
I will. I'll give your guys' love to her for sure. She really wanted to be here. So thank you for thinking of
Izzy,
her.
her thing is hugs. You need to give her a big hug from Izzy.
Yes. Yes. Big hugs to my wife. She loves you.
Right? Yeah.
Okay.
So much. You have a good rest of your day.
Okay. Have a good night, you guys. Thanks so much. Okay, we'll see ya.
Bye.
Bye.